Just one second. Good evening to all IFPH members, doctor, and my dear colleague. I'm Dr. Rachita Tripathi, today's moderator. And again, a warm welcome to all who are attending the English session. This is our 2019 day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy on 10th July 2026, Friday at 8:30 p.m. Now, before proceeding, we have 1 minute silent prayer. And our today's guest is Dr. Rajit Kumar Ramawat. He is MD Homeopathy, PhD scholar, and Assistant Professor at Department of Homeopathic Mitra Medica, Rajkot Homeopathic Medical College, Parul University, Gujarat. Dr. Ramawat Clinic and Research Center, Gujarat. He is owner of Homeo Ocean Homeopathic Pharmacy and founder of the Homeo Ocean YouTube channel. And his today's topic is about National Deworming Day and Homeopathy. Uh, Sir, have a warm welcome to you. Please, you can start your presentation.
Please,
Dr. Ramawat, Rajit
please,
Kumar Ramawat, sir, a very warm welcome to you.
please wait. Please wait. I think
Oh, okay, sir. Might be
you can
he
talk
has not joined.
something about the subject.
Okay. Uh, just one second, sir. It's about National Deworming Day. As we all know that about deworming to uh, deworming about in a school we have seen many sessions doctors taking deworming about to kill intestinal worms. And in homeopathy, there are many medicines like Sina, Pyglia, and Stramonium. But in school, since we have seen in during my time, the doctors give albendazole children fortnightly, and children 1 to 2 years having have many problems regarding worms. So they have given medicines, and worm infection are common in areas where there are humidity, and due to malnutrition, less nutrition, children fall into the infections. And deworming is also both. Worm infestation is also a cause of many infections. So, if anyone have any new uh, things regarding this, they can talk.
Yes, we can invite Panda sir. Please unmute sir.
Okay.
Thank you, sir. I am audible.
Yes, sir.
As Madam told, in homeopathy, we have no medicine to kill the worms. We have medicine to restrict them to get the food to grow. So, accordingly, we are prescribing because our medicine are non-toxic and our medicine are not wormicide. Second thing, for different types of worms, there are different medicine in homeopathy, as mentioned in Boric Metamedica. But as Madam told, in allopathy, they used to give single dose of albendazole. Second thing, on the basis of symptoms, we should prescribe Sina, then granatum, then santonine, then teucrium. So there are different medicines for worm trouble. So when the patient is a baby and indicating the navel region as painful region, so we should think about Ascaris lumbricoides, and for that Ascaris lumbricoides we can prescribe Phygelia. So the symptoms are more important, and if the baby is rubbing his nose and pricking his nose, then you should think about SINA, and the mental symptoms of SINA are very important. So when the patient or the child wants many things, when you offer, he rejects it. So, and SINA child, that restless child, so always becoming angry, and even there is itching of anus, will get in SINA. Same thing, there is another medicine, rhododendron, that is also a very good medicine for pinworm. So these things are mentioned in our boric mathematica under different medicines. Even sulfur can be prescribed. So worm trouble generally it is seen in the early childhood, and in adult we may get hookworm infestation. So for hookworm infestation, that may occur in adult also, because hookworm have the tendency to suck the bloods. So in those cases we have to prescribe our medicine, and we have to advise the patient or subjects to be neat and clean, because these worm infection can be controlled by different levels of prevention. So prevention measure must be taken as mentioned in community medicine. The 5 levels of prevention we need to remember. Those 5 levels of preventions, the first level of prevention, that is health promotion. So the health promotion is most important part. So under that we need to maintain the hygiene, diet, neat and cleanness. That's why in primary school it is advised daily that you must clean the hands, and hand washing in hospital infection, hand washing is very important. And if you do hand washing, our water will be clean, then you can prevent from worm infestation. So then we can give your medicine. But if you will not maintain the hygiene and will prescribe the medicine, it is useless. So in worm infestation, certain symptoms we need to observe. Even during inspection, we have to do the physical examination properly to find out the worm infestation. If there will be pale sign in the face, then these are the indication of worm infestation. And if the patient is pricking the nose, and if the patient is rubbing the nose in the shoulder of the mother, and if there will be pinworm, even pinworm is one of the cause of leukorrhea in little girls, because these pinworm, they come out of the anus and they irritate the batholian glands. That's why the leukorrhea occurs. For those little girls leukorrhea, we are having medicine calcarea carb, and Cilicia also. So sepia. So we have to take the case properly. We have to consider the age of the patient, and the pinworm problem is more in case of small child below 5 years. So, and those pinworm irritate the child, and there is itching, restlessness, the child cannot sleep. That's why the proper medicine should be prescribed in homeopathy. Again, I want to share with our colleagues that the worms, we have our medicine not wormicide. Our medicines, they restrict the growth of the worms. The worms, they will not get the nutrition. Because of that, they will not grow. So from the root we can prevent, we can cure the cases. Third thing, so the worms generally which are found, they are roundworm, Ascaris lumbricaris, adult hookworm, then in child pinworms, and even those who are eating the meat of what are pig, they are used to suffer from tapeworms. So the people, those who are eating the meat of pig, because the tapeworm they remains there. So we have to find out again. We have to take the investigation. Investigation is also important, of course. Investigation, positive investigation will get after the worm infestation, not before. But in homeopathy, in the beginning we can prescribe the medicine on the basis of the symptoms, or specifically in baby we are not able to get subjective symptom. By objective symptom and certain behavior of the child helps us to find out the medicine. Second thing, for worm infestation in adults, apart from hygiene, we have to think about certain medicines like thymus. Thymus is a very good medicine to for the treatment of hookworms. And hookworm in village area, hookworms are the main worms. Because of that, most of the adults, they are suffering from anemia, because hookworms used to ankylostomum duodenale, the hookworms used to suck blood. Because of sucking of blood, the person will suffer from anemia. So in those cases, there is no use of any blood transfusion or any iron tablet or folic acid. So we have to give the particular medicine on the or therapeutic medicines. Again, the mental symptom also we need to consider. In one trouble, as we know that the common name of Sina, that is worm seed. So when there will be one infestation, the child become irritated. So when the child become irritated, prick the nose, rub the nose in the shoulder of the mother, and wants many things, reject everything when it is offered, and want to take sweet things, then we may consider about Sina also. Dr. Manoj sir, do you want to share something else, because the speaker has not come yet?
Yes, definitely. And of course, you know what yes, thank you, sir. Of course, we have definite methods to address the problem of the worm troubles or enterobiasis, as rightly mentioned by Dr. Samuel Henneman, I think in the preface or introductory part of the organ of medicine. To give the Felix Mass is the medicine advised by a master. That too in tincture, followed by the anti-historic medicine. Let the former be removed with this male form tincture, and the latter, that is the soric miasmatic background, should be removed or corrected with the appropriate anti-soric medicine. This is the advice given by a master. And again, the dietary regimen is also important thing. It's better to avoid, minimize, not avoid, it's not possible, to minimize the sweet things to the food, the sugar, as well as the pastries. That should be allowed to use in only in moderate quantities. In that way, also we can regulate to a certain extent the problems. Then, as you mentioned, another thing is the leukorrhea. It's also a very important thing. And I think homeopathy is a long system of medicine which can contribute or at least sterilize to the patient who are suffering with this condition. Not only children, but also in the grown-up women. That's also a major problem, sir.
Yes, sir. Actually, in allopathy or conventional system, the medicine which are used to prescribe by them, albendazole, mebendazole, pyrantel, palmoate, then these medicines, they only kill the worms, but again the worm they will create it, because they are getting the food inside the gut. And we have to find out the symptom and the predisposing factor also. The predisposing factors of worm infestation, that is poor sanitation, contaminated food and water, walking barefoot, poor hand hygiene, malnutrition and overcrowding. So these are some predisposing factors we have to consider it also. And the clinical features generally which we are getting in worm infestation, that they are abdominal pain, distended abdomen, then nausea, vomiting, altered appetite, weight loss, weakness, anemia, growth retardation in children, because the retarded growth is one of the that is due to the worm infestation also. So we have to diagnose as early as possible, and we have to select our medicine. And the characteristic symptom of worm infestation, they are anal itching, especially at night because of pinworm. So when the pinworm are the causes, then there will be anal itching and passage of worms in stool. Then grinding of teeth during sleep, reported by caregivers, and which are not specific, but that is a symptom in SINA. Grinding of teeth will get. So when the child during sleep grind the teeth, then you may think about worm infestation, and the medicine SINA can be given. Restless and disturbed sleep, because as I told that when the pinworm they come outside, they irritate, they enter inside the vaginal canal, they irritate the vagina, so it leads to pruritus also. So when the pruritus occurs, then worm infestation is one of the cause of that pruritus. Then persistent cough, in some cases because of worm infestation, persistent cough occurs. So when persistent cough occurs and well selected medicine fails, then you have to go for investigation, and if worms are found, accordingly we have to treat the case. A stool examination will get the ova of those worms. Second thing, a pinworm, and the child will suffer from eosinophilia also. Hemoglobin estimation must be done in case of hookworm infestation. Then about homeopathic principle, we have to treat on the basis of individualization. We should not consider, suppose 5% will come, all are suffering from pinworm, so all will not require teucrium, all will not require rhododendron. So on the basis of mental symptom also we can change our medicine. The case may need santonine, the case may need granatum, the case may need sulfur. So accordingly we have to select the medicine. Homeopathic management, first one, that should be the patient should be dealt on the basis of individualization. Totality of symptoms are the guide of selection of medicine. So mental symptom must be considered, as Hahnemann advice that in physical symptoms, mental symptoms bears more value, and mental diseases, the physical symptoms more value. That's why we have to consider them. Then assessment of constitutional tendency, even constitutional tendency, because constitution is the soil in which the disease grows. So if you will consider the constitution, so suppose you will give SINA and the patient gets relief, and the patches which are found in the cheeks, it is vanished, and till then after completion of the cure we have to give constitutional medicine to prevent recurrence. So worm infestation again and again if it is occurring, then first we have to consider the hygiene. If the hygiene is proper, then we have to give constitutional medicine to prevent the recurrence of the disease. So it is most important. Then consideration of maintaining cause, like poor hygiene I have already told, and acute prescribing for symptomatic relief, and constitutional treatment must be given for recurrence as I mentioned. And I want to share some medicines. Those medicines are prominent medicine for worm infestation. They are SINA, teucrium, spigelia, santonine, then calciracar, sulfur, lycopodium. So these are the prominent medicine can be prescribed on the basis of symptom totality. So as a homeopath, we need to treat the patient, not the disease. Whatever may be the symptoms, they are the outcome of the disease. They are the as mentioned in 7th aphorism, Dr. Hahnemann has already mentioned that the diseases are nothing that are outwardly reflection of the internal essence of the disease. So the one they can do any derangement in vital force, when our vital force will be deranged, because in regular basis whatever hygiene we are maintaining, but still then the ones they are present inside our body, but they cannot do any harm, because of the strongerness of the vital force. Unless and until our vital force becomes weak, our constitution becomes weak, if the soil is in favor of the worm infestation, then only the worm can infest, otherwise it is not possible. So constitutional medicines must be given. As I told, if the baby show the naval region or the painful region, then we should think about Ascaris lumbricoides or roundworm. So for that purpose Spigelia can be prescribed. So the difference is the main symptoms which are found in different medicines. Sina is indicated one of the, this is the one of the chief of the worm infestation medicine. Irritable child, boar's nose, grinding teeth, pig's nose, ravenous appetite, abdomen hard, and distended itching anus. So these are the prominent symptoms of Sina. So if the Sina child is not grinding the teeth, or he is not pricking, then there is no hunger. Canine hunger Sina we have already read, because the nutrition is taken by the worms, the child becomes hungry and wants to eat more, and even sweet Sina, the child requires sweet, and there is the stool is whitish stool you will get in Sina. In Teucrium marum verum, marked anal-itching, especially due to pinworms. Constant irritation in rectum. If there will be constant irritation in rectum and that is marked anal-itching, then especially pinworm. Pinworm generally occurs in small babies, and they because of that there is irritation and the baby cannot sleep in the night, and it is her or his anal region. Then Spigelia, I have told already, roundworm infestation with abdominal colic and neuralgic pain. Because Spigelia is a very good medicine which is prescribed not for worm problem in adult. It is a medicine for hemicrania, and Spigelia is a medicine for eye pain also, and heart medicine. It is heart medicine. So in adult, but in child it is a very good medicine for ankylostom, for roundworm infestation. Then we should not consider more towards the what type of worm infestation is there, but on the basis of symptoms which are available, on that basis if we select the medicine, then our medicine will work. But definitely after the worm infestation is over, we have to give constitutional medicine or anti-miasmatic medicine to prevent the recurrence. Then Santonine is a very good medicine for worm infestation. In case of Santonine, the worm symptom with disturbed vision. So if the child is not able to see, then that is not because of the myopia. Most of the child nowadays, because of use of computer and mobile and TV, so what is happening in early age, the child they are suffering from myopia. For myopia, our medicine is physostigma. In Boric Mathematica, it has been clear mentioned that if there will be short-sightedness, then we have to think about physostigma. So physostigma also a very good medicine for low blood pressure. For high blood pressure, our medicine, that is Rauwolfia serpentina, yes, that is therapeutic medicine, not on the basis of totality of the symptom. There are so many medicines are there, but the specific medicine Rauwolfia serpentina or ashwagandha, that is the specific. And what I am telling for disturbed vision, there are several medicine, but if the case is of a child, we have to examine. Stool examination should be done, and definitely if it will be because of the worm, then Santonine is a very good medicine. Otherwise, in early age, the child they are suffering from myopia because of computer syndrome. So that is nowadays it is growing, and in the early age, the child they are using the convex lens. Then calcarea curve is another. So whenever there will be worm infestation with disturbed vision, abdominal pain, irritability, and convulsion. Yes, convulsion you will get in Sina also, and convulsion you will get santonine also. So worm also causes convulsion. So when there will be convulsion, always we should not think that it is related to brain or disturbance in central nervous system. We should consider that this may be because of worm infestation. When there will be increased number of worms, then they may irritate our nervous system and convulsion occurs. So when the patient is child and suffering from convulsion, there are so many medicine. Even aconite is a very good medicine for convulsion. Here for convulsion, cuprum metallicum is a medicine. But there is epileptic convulsion also. There is hysteric convulsion also. But we have to differentiate between those convulsion. For those who have become those who have belongs to hysterical convulsion, so they must be adult before marriage. But epileptic convulsion, so we have to diagnose properly. That may be petit mal, that may be grand mal. So that is because of the disturbance of electrical discharge inside the brain. So we have having sufficient knowledge about the pathology, about the diagnosis. If a doctor who is having good knowledge in diagnosis, he can select a good homeopathic medicine, because he will be able to discriminate between common symptom and uncommon symptom. So some cases what is happening, so we consider the symptom as charismatic symptom, but they may be the common symptom. For example, in sorinum, let us take the case of asthma. In sorinum, what happens in asthma? The asthma ameliorated by lying down. So sorinum asthma, that is a charismatic symptom. But if you have having knowledge of nosology knowledge, then the person who is suffering from asthma can get relief by lying down if he is suffering from anemia. In case of severe anemia, iron deficiency anemia, where iron is less, then what will be happen? The person will suffering from breathlessness. So in those cases, if the person if the person sleep, then get relief. So if we consider the symptom that asthma ameliorated by lying down and we are prescribing sorinum, then we will be fail. So certain symptom must be considered as common symptom, and on the basis of common symptom we should not prescribe any medicine. Same thing, another example I am giving in case of Marksal. In Marksal there is a symptom that the patient passes more water than intake. That means if the patient will take 1 glass of water, he will passes 2 glasses of water. So that is a charismatic symptom with imprint of the teeth, more salivation in the tongue. But if that patient is suffering from ADH deficiency, antidiuretic hormone deficiency, then but naturally the absorption of water in distal convoluted tubule will be less. So where the absorption is less, then the person definitely pass more water. So this is a common symptom of ADH deficiency. So in those cases, if we prescribe Marksal, definitely will fail. So when a case of worm infestation comes, so even the case of convulsion comes of child, then we must investigate. Pathological investigation must be done for worm infestation. If we will leave that portion, then we will fail in spite of selecting good medicine on the basis of charismatic symptom. So in santonine, we need to consider the vision. The child will not able to see. There will be haziness, and the eye specialist will not find any defect. And in those cases, your santonine is a very good medicine with abdominal pain, irritability, and convulsion. Then the next medicine, that is calcarea. Calcarea, it is a constitutional medicine. We all know the calcarea patient is fair, fatty, and flabby patient. If the child is fair, fatty, and flabby with recurrent worm infestation, after taking albendazole, again same thing is appearing. In worm infestation, the conventional medical doctors, they used to prescribe single dose of albendazole. So after taking that single dose of albendazole, the child get relief for 15 days or 1 month. Again same thing appear, because we are removing the outcome, we are not removing the cause. The constitution, the soil in which the worm infestation occurs, that was not treated properly, that was not enriched properly. So our aim and objective is to strengthen our constitution, is to strengthen our soil by which the worm they cannot grow. For example, in our area, I am living in Gujarat. The soil is beneficial for carpus, yes, cotton, but in this soil we cannot grow the apple. So for apple Kashmir area is fit. So if you will make it fit for apple, then we have to enrich the soil. Likewise, when again and again a child is suffering from worm infestation, we have to enrich the soil. When you enrich the soil, the worm they cannot able to grow, they will not get the proper nutrition from that soil, so the worm infestation cannot be occur. So after getting cure, whatever system may be, if the parents they are complaining that my child is suffering from worm infestation again and again, then the child is looking fair, fatty and flabby, and there is more sweating in back of the head, neck region, head region, then we may think about calcarea carb, and calcarea carb is a great antisoric remedy which helps to prevent recurrence. Then sulfur is very good medicine for worm infestation, for chronic recurrent infestation with itching, unhealthy skin, offensive stools, constitutional psoric background. If the patient is having constitutional psoric background, that means the parents, we know, if the parents they are psoric, then the offspring will be psoric. That means if both the parents they are psoric, then the offspring will come with secondary manifestation of psora. So in secondary manifestation of psora, worm infestation can occur. As you know, psora causes all type of inflammatory diseases: psychotic, infiltrative and proliferative disorders, syphilis, destructive disorder. So sulfur is a very good medicine for worm infestation, and even we know that sulfur is the medicine which make our case clear. When we are not clear or the symptoms are not clear, then in those cases we can give sulfur. So sulfur helps to make our case clear. When our case become clear, the sign symptom is prominent and precise, then you can select the medicine as per the symptomatology is concerned. But sulfur is a very good medicine for chronic recurrent infestation with itching, unhealthy skin, offensive stool, constitutional. Yes, unhealthy, we know sulfur child is often is ugly child. Ragged philosopher is the key symptom of sulfur. If the child is unhealthy, looking unhealthy, and itching is there, and then we can think about the sulfur. And sulfur not only cure, it also prevent, it also strengthen our constitution, that is deep acting antisoric remedy. So for antisoric purpose we need to remember SCL. S means sulfur, C means calcarea carb, L means lycopodium. These three medicines are deep acting antisoric remedy, SCL. And SCL must be remembered because one after another the medicine they follow well. So after sulfur the calcarea carb is indicated, after calcarea carb the lycopodium is indicated. So in this sequence, because the medicine they follow well one after another, if you prescribe the medicine one after another, then it will work marvelously. So sulfur is a very good medicine for worm infestation. Then you come to the next medicine, that is lycopodium. So lycopodium is also very good medicine for worm infestation, and we know in Boric Mathematica it has been written that lycopodium takes 9 days for its action. So we have to wait and observe. As our in previous lecture, the madam was seeing madam that we have to keep patience. So in homeopathic practice, if our medicine is correct, then we have to wait and observe. If the symptoms are improving, then repetition is contraindicated. If you repeat medicine, if you give medicine again and again, or we alter, we change the medicine, we ourselves will disturb our case. So the case will be more complicated. So we have to, before selection, we have to select properly, as Hahnemann has written in case taking chapter, that if the case is well taken, then half of the cure has been established. So proper case taking must be done. Before selection, the choice must be correct, because after choice we have to come under choice, because if we will give the medicine, then the medicine will act. So if it is correct medicine, we are confident. If the potency is coincide the susceptibility of the patient, we should not be bothered. We have to wait and we have to observe. If needed, then you have to give placebo for time pass. So we should not be hurry to change the medicine. We should not be hurry to repeat the medicine. So lycopodium will be prescribed when there will be bloating, when there will be flatulence, right-sided complaints are there, poor digestion with worm tendency. So flatulence, lycopodium, then carbovage, and then calicat, these are the flatulence remedy. So lycopodium, when there will be accumulation of gas in the lower part of the abdomen, and the patient is getting relief by passing the platters, then lycopodium is very good medicine. And lycopodium patient is a hurry patient, and the child, in case of child, it is emaciated child. So lycopodium, abrodanum, iodum, natromur, tuberculinum. So these are the silicias, calciraphos. These are medicines which are prescribed for malnutrition. Here the lycopodium medicine need to be prescribed when the upper part is semidropsical, lower part is emaciated, and the patient is craving for sweet. If the baby is crave for sweet, and if there will be accumulation of gas in the lower abdomen, and the patient gets relief by passing the platters, and bloating, and there is poor digestion, the digestion is very poor, then you have to think about lycopodium. So lycopodium, but we need to remember about the selection of potency. The selection of potency must be perfect, or as Hahnemann advised in 6th edition of Organon. So to solve the potency problem, to minimize the homeopathic aggravation, that is 50 millisimal scale. So in 50 millisimal scale, there will be no problem of selection of potency. There is no problem in repetition. We have to start in 0/1. For example, Sina 0/1 should be started, and it will continue. Then 0/2 after 1 week. Then till the cure ensue, we have to prescribe the medicine. Apart from this, hygiene must be considered in case of worm infestation. Then nowadays worm infestation cases are decreasing because of cleanliness, because of use of sanitary latrines. Previously, the patient are usually go to the outside to pass the stool. So once they entered inside the nail bed and comes to the body, and they are infested. So nowadays these are decreasing. So use of sanitary latrine is very useful. Then the next medicine is natrum phos. Natrum phos also is a very good medicine for worm infestation and acidity also. So when biochemic need to be prescribed, then natrum phos must be considered. So natrum phos, the symptomatology, the stools are sour, acidity is there, once associated with hyperacidity. For hyperacidity with worm infestation, natrum phos is the medicine, and other acidity medicines are there, but natrum phos is indicated especially when it is with worm infestation. So other medicines we know for acidity, the Irish bur is also medicine, Robinia is also medicine, but these are the medicine when acidity is not along with worm infestation, but natrum phos is the medicine when there will be hyperacidity because of worm infestation, then it is indicated. Biochemic may be prescribed here. So natrum phos biochemic need to be prescribed, and then you come to the next medicine, that is Moxal. So Moxal is also very good medicine for worm infestation. In Moxal, we should consider about the stool. There will be slimy stool. Moxal, we know that is the king of dysentery and king of syphilis. So if the stool is slimy stool, there is urging, there is tenesmus, offensive breath is there, excessive salivation with intestinal irritation. Then you have to think about Marksall. Again, Marksall is indicated when there is worm infestation with cough. The cough is double paroxysm cough, and the tongue is flabby. It takes the imprint of teeth. There is salivation, which the tongue is wet, but there is thirst. So Marksall is indicated there. So Marksall is very good medicine for worm infestation. When there will be slimy stool, there will be urging, not satisfaction, there is tenesmus, the child has to strain to pass the stool. Then the breath is offensive because it is antisyphilitic, so the breath is offensive. Then the next medicine let us come, that is Felix. Felix is a very good medicine traditionally used for tapeworm infestation. So as I have already mentioned that for tapeworm, those persons who are eating the mutton of what a pig, they are suffering from tapeworm infestation. So certain diseases in examination also we are asking, certain diseases they occur in Hindu but not in Muslim. For example, phimosis and paraphimosis. So because of circumcision in the early age, so the Muslim people, they are not suffering from paraphimosis and phimosis, but Hindu suffers. Likewise, the Muslim, they are not suffering from tapeworm infestation, whereas the Isai, they are suffering because they used to take the meat of the pig. So in patient profile, we must note that about the diet and regimen or habit of the patient to know. So Felix is a medicine traditionally used for tapeworm infestation. So tapeworm infestation occurs because of taking red meat of pig, because in the meat of the pig the tapeworm they remains. So these are the some medicines which need to use for worm infestation, and there we have to do some auxiliary measures also. Under auxiliary measures, maintain personal hygiene, neat and cleanness, nail must be clear, and sanitary latrine must be used. Then second thing, wash hand before meals, because worms will be there will be no worms, so in soap water whatever available we have to clean the hand, and hand wash method must be followed. Then keep fingernails trimmed, wash fruits and vegetables thoroughly, because through vegetables and fruits the worms may come. Then hello sir, I am audible, sir?
Yes, sir. Everything fine. Everything fine, sir.
So drink safe water. So nowadays it has been mentioned that RO water are not good, and those who are using regular RO water, they are suffering from anemia. So warm water, natural water is better than RO water. Of course, I am using RO water, but today in the Times of India, I go through the Times of India and I got that RO water. If you use RO water for longer time, you may suffer from anemia, because when filtration occurs, the some minerals they are filtrate which are needed for our body. Then avoid open defecation. So now after the advice or suggestion of the Modi, nowadays even in village area nobody is going outside. That's why what is happening, that the defecation must be avoided in open places, because from the soil the worm they entered. So because of that they entered, they are through the hand. If you will not do hand washing properly, they will enter in the mouth and they go inside the stomach, and their infestation occurs. So avoid open defecation, wear footwear outdoors. So whenever we are going outside, then we must use footwear. So if we use footwear, then the worm they cannot enter inside our nails or toes. and they cannot enter inside our body. So footwear must be used whenever we are going outside. Then deworm family members when indicated. When anybody of our family is indicated that he is suffering from worm infestation, then immediately the treatment should be done, because from that person the worm may spread to other person. Because in our family what happens, if we have children, they used to take food and during eating the food, the worm from the infected child may enter, and that worm will go to another child. In this way the worm infestation spreads. Generally it is advised nowadays take food with family, but not in the same utensils, and utensils must be sterilized in home with warm water time to time, so you can be prevent worm infestation. Next, improve nutritional status. So if you increase the nutritional status of our child, then what happens, our vital force will be stronger, and when our vital force will be stronger, it will not allow any scavengers to manifest inside our body. So to make our vital force strong enough, we have to provide nutritious food to our child. So when the child will get nutritious food, then the future of the nation will be also bright. So good nutrition must be provided to the children, by which they will be strengthened, and they will not suffer from any type of worm infestation. So these are the auxiliary measures we have to take to prevent worm infestation. Second thing, last one, that is prevention. So prevention is better than cure. 1 ounce of prevention is 1 pound is equal to 1 pound of cure. So preventive measures must be taken. So if we take preventive measures, then worm infestation can be stopped. Under prevention I have already told that 5 levels of prevention must be followed as mentioned in community medicine. So under prevention, health education is needed. So we must aware our children in village area, in slum area, in school, by awareness program. So what is the importance of hand washing, what is the importance of nail trimming, what is the importance of hair cutting. So these things must be, what is the importance of use footwear. So this awareness program must be conducted in our schools, by which the worm infection can be prevented. Then proper sanitation, as I have told, neat and cleanness, and barefoot, avoid barefoot. So these are proper sanitation. Then safe food preparation. So even preparation, where we are preparing food, that utensils must be clean. And if we clean the utensil, sometimes what happens, we eat cold food without cooking it. So in those utensils, for example salad, so whenever you are preparing salad, the fruits which are used to prepare the salad must be cleaned, and to prevent the worm infestation, the utensils which are used to keep these salads must be clean, by which the worm infestation can be prevented. And after coming from outside, after duty hours, we must clean our hands and legs and face, so again and again, by which the worm infestation can be prevented. Periodic deworming in endemic areas. So where the worm infestation is prevailing in endemic area, so we have to keep periodic monitoring. Even we should not give albendazole. Even if we give Sina in lower potency, we can prevent worm infestation of that endemic area. Especially in slum area, where the person, they are not getting proper nutritious food. So we have to contact with charitable trust. They will distribute food with nutritious food in that slum area. If the child, they will get nutritious food. Nowadays the government is starting the program. The government is providing mid school diet, that means midday full food in schools, because in slum area, in lower economic status area, our children, they are not getting proper food. So nutritious food, awareness, these are highly essential. And periodic deworming in endemic area, in allopathic, in community service, every 3 months they used to give albendazole single dose, liquid dose to the children to prevent worm infestation. So in this way, we homeopath, we can select as a genus epidemicus. We know in epidemic, where the epidemic is prevailing, in those cases we have to select a genus epidemicus, and we have to distribute it in that area, in particular area, along with the albendazole. So research must be done by which the homeopathic medicine can be used for prevention purpose. When you use homeopathic medicine, it will be more safer and side effect is less. So we have to distribute in advance the homeopathic medicine, Sina, Santonine, Granatum, etc., Spigelia, in those areas which are in which the worm infestation is prevailing. Then wand washing technique, we have to give training to the school children how the 7, as described in NABH, that there are 7 steps of hand washing. So 7 steps of hand washing must be trained to our colleagues, and they should go to the school and village area to train them how to wash the hand. Regular nail trimming is must. So in school, during the prayer times, in our village, the teachers, they are seeing whether the nail is proper or not, it is trimming or not, hair is proper or not. So everything must be, this type of follow-up must be done. Then only we can prevent. Then in homeopathic approach, I have already told that medicines are there, but approach should be homeopathic, like detailed case taking must be done. What are the symptoms? If the patient is indicating the navel area as the painful area, then Spigelia should be prescribed. If the child is rubbing the nose in the shoulder and pricking the nose, grinding the teeth, Sina must be prescribed. So proper case taking is required to treat the worm problem. Then evaluate nutritional status and hygiene. So we need to evaluate. We need to check whether the patient is anemic. If the child is anemic, that may be due to worm infestation. So investigation of stool of the prevailing area must be done time to time to know that why what type of worm infestation is prominent in that particular area. So accordingly, you have to give the medicine. If the area is prominent in ankylostoma duodenale or round one, then Spigelia must be prescribed. If there is pin one, then sulfur or rhododendron must be prescribed. So as per the worm, the preventive medicine should be selected as mentioned in our Mathemedica, and then it can be prevented. Second, rule out complications requiring urgent medical care. Sometimes what happens there, the worms, they entered and they affect the lungs. So because of worms, there is diseases of lungs may occur. The child may suffer from pneumonia, and so in those cases, immediate medical care must be taken, and if it is required, the patient must be sent to the proper higher center. Select the simillimum based on the totality, I have already told. Then follow up clinically where appropriate with stool examination. Then refer immediately in cases of intestinal obstruction. Yes, intersusception is one of the cause of worm infestation. What happens? The worm, the embolus-like structure they forms, and they obstruct our intestine. So when there will be intestinal obstruction, so it causes a medical emergency. So in those cases, we have to refer the case to the higher center for the survival. Then clinically, then refer immediately in case of intestinal obstruction, severe anemia, dehydration, or other complications. So these are some area of approach. Then miasmatic interpretation must be done. Where recurrent infestation are there, in spite of, constitutional prescription. So in miasmatic interpretation is required in case of recurrent worm infestation, and soric miasm is the predominance miasm. So here sora is predominance miasm. So as I mentioned, the deep acting antisoric remedy, sulfur, lycopodium, calcareous. So these are the medicine which are indicated to prevent worm infestation and recurrence of worm infestation in case of child. Because if we make our child healthy, then our country will be healthy. So we have to give stress on our child, for the health of our child, for the betterment of our future. So it is a burning problem, and we homeopath, we need to take the responsibility and distribute our medicine to prevent, to cure the worm infection. Importance of constitutional treatment I have already mentioned. It enrich our constitution, and when our constitution will be strengthened, then the worm infestation, not the worm infestation only, the other diseases, even if we prescribe constitutional medicine, then recurrent cold can be prevented. So for recurrence, we need to prescribe miasmatic medicine, and again intercurrent medicine may require during the treatment. So during the treatment, if it is needed, if the well indicated medicine fails, then we may prescribe intercurrent remedy, generally nosodes. So intercurrent remedy in higher potency, nosode can be prescribed, sorinum. If it is required, other antisoric medicine can be prescribed. Then integration homeopathy care with public health measures, nutrition and conventional deworming when indicated. So
Yes.
integrated approach must be there. So if we will do integrated approach, then that is the mission. Our mission, as Hahnemann mentioned, the high and only mission of the physician is to restore the sick to health, to cure as it is termed. So this is about my sharing about worm infestation. I am very much thankful. So our program should continue, and if we discuss, we
Yes.
interact, then it will benefit our fraternity. Thank you very much,
Yes.
sir.
Thank you, Professor Bibhu Prasad Pandya sir, coming over here all of a sudden and making such a big session. And it's a great session indeed. And even though people used to say that this particular deworming day is a very simple thing, and what the purpose of this thing, but you really mentioned every aspect of this deworming, whether it is what are the medicine coming up for homeopathic treatment, and how we can manage, what are the theories to be looked into, and how you can prevent it, and what is the importance, and how we can deliver the genus epidemic for such a simple thing. But it is not at all a simple thing. As you once again you mentioned about the recent condition, pathetic condition of our rural area some years back were totally changed nowadays, and the people are in a better living condition. They are having high sanitary conditions now only, but even still, there are places where people are finding it difficult to get pure water, proper sanitary measures also. So in those conditions where we need to give these kind of preventive measures, as well as the government need to give a more healthy condition of living for them. And in the urban area, there is no need of giving all these preventives, what's supposed to be they are giving. And so this is what I would like to add to. Congratulations once again for this session, and thank you all for joining this session, as the time is already over, because though there was a short delay in beginning the session, but we just conclude the session here. Over to our tomorrow, we will have a session from Dr. Prindu Srivastava, and